I'm Erica Natividad at the COVID-19 Assessment Center at the Peel Memorial Center in Brampton. This is one of a number of assessment centers that have been set up and will continue to be set up around the province. Now, in recent days, we've received a number of inquiries, people unclear about what the protocol is around testing and self-isolation. Of course, the situation is very fluid. It changes day to day, but we are getting regular updates from health officials. In the meantime, though, here are some key things that you need to know.
I have, some coughing, which isn't abnormal for me, but you start to get paranoid of whether or not your cough is getting worse.
Jennifer Pilo and her fiance returned from Florida on Sunday. She says they were out in multiple places with public gatherings. A few days after they returned home, they decided to call Toronto Public Health.
I waited for 2 hours on the phone. I explained to them, some small symptoms that I have and my partner has. And she told me that the U.S. was not a flagged source country and that we were essentially fine. It just left a confusion with us on what we are to do. If we should get tested, if we should quarantine, we don't know.
On Friday, the City of Toronto began asking residents who have traveled outside of the country within the past 14 days to self-isolate. They're also asking travelers to be vigilant and monitor their symptoms, as well as avoid public gatherings and contact with vulnerable people, including those with chronic illnesses and the elderly. These new measures taking effect from March 14th to April 5th. This afternoon, dozens visited the COVID-19 Assessment Center in Brampton. They were screened before entering the parking lot and triaged at the door to determine whether they needed to be seen or tested.
Many are just anxious. Some don't meet the criteria.
So what qualifies you for a test for COVID-19?
Have you come into contact with a known case and you also have flu-like symptoms? Okay. And those are the patients that need to be assessed.
It's a major shift from the previous criteria for testing. Now assessment centers will also test healthcare workers with respiratory illness and people with respiratory illness who are from long-term care or retirement homes, as well as First Nation community members living on reserve. The Ministry of Health has changed the criteria to manage the volume showing up at the designated assessment centers. Anyone else who has concerns are asked to call their healthcare professional, Public Health, or Telehealth Ontario. We asked Dr. Martino about Jennifer's case.
I would say to that patient to stay at home, see how their symptoms evolve.
So again, just beware of that criteria before you come down here. If you decide to come down here, we have been here for most of the day and it has been quite busy. Staff here say they've registered about 170 people for the day here, and they were processing people at about 10 to 20 per hour. If you do decide to come down here, just be prepared. There may be a long wait even when you're waiting in line to get processed. So dress warmly for this weather.